Mrs. D is a 40-year-old who presents to the hospital with extreme fatigue and weakness. Again, extreme fatigue. All right, I'm not talking about your usual fatigue. She said she's very weak to the point that she cannot stand up and do basic things at home. Her creatinine is elevated to 2.4 from baseline. When you go into the room, you think she looks 20. Her skin is very tight and shiny. She also complains of her fingers turning white, which is new. What do you think about her diagnosis? How would you work this up and how would you treat? I had a case just like this actually, and I went in with my attending into the room, and then he was a very smart attending. And then before we went, he said, "Don't look at her age." And then we went to see her, and then after we came out, I thought she looked 20, and this patient was actually probably even older than 40, maybe even 50. She didn't look like that at all. Her skin was so shiny, and she looked very young. And this actually was a disease that she had. It's interesting. This is what we call scleroderma. Another name for it is systemic sclerosis. So when you see a patient who has this, just know that they're the same diagnosis, they just have two different names. It's a systemic autoimmune disease, can affect any organ in the body, meaning hard skin, okay, and it can cause skin fibrosis, and that's why these patients look much younger and their skin is white and shiny and stretched, okay, and it's more common in women as well.